We welcome Bobby Schilling.
You should live with my children, then you change your mind. Corporation of America, and from Container Corporation of America, I went to work for Prudential Insurance Company of America. I like all of the Americas in there. And then from there, I decided to open up my own business and become self-employed so that I could control my own destiny, as I would call it. So enough about me. What I want to do is just kind of give one of the reasons this is near and dear to my heart is my father, who became sick, who was a veteran, he was in the Korean conflict. What happened is we constantly had to, the last few months of his life, had to bring him to the VA clinic. And granted, there are some good folks that work in the VA clinic. When we went there, it was more like we were going to the driver's license facility. And it just wasn't the same as going to a hospital. And my concern is, if the government takes over our health care, we're going to have that driver's license facility across the entire United States of America. So enough on that on myself. What I want to do is just kind of open it up for some questions and then answer them as best as I can. If I can't answer it, I'll tell you, hey, I don't know that, but we'll get you the answer. So if anybody would like to start out, we'll just hammer away here. Yes?
What alternatives would you propose for the health care?
What I think we need to do is rather than, first off, we need to take a look at this thing right here. This is the bill right here. I've read through about 3/4 of it. I'll have it finished by the weekend. I do not believe for 1 minute whatsoever that our founding fathers set it up to have these things roll through. I believe something like this, if we have to have something this big, it needs to be broken down into 25 or 50 sections. This weighs 10 pounds. So maybe we should just put a law in that no bill over a pound. Something like that. There's several different things we can do. One would be tort reform. There's a lot of things that aren't being addressed that need to be. Another thing would be taking the states, and instead of forcing companies to just compete within one state, put it all the way across the United States. We need to definitely address the doctor shortage. And that's one of the problems that that every administrator at the hospitals that I've talked to that we're going to run into is we already have a shortage of doctors. And if we have all this huge influx of what they want to have happen, it's going to be an access issue then. So, you know, tort reform, there's 47 million people that are uninsured. And there's, I think it's roughly around 15 million, 12 to 15 million that are illegals. And then there's 9 million that they have incomes in excess of $75,000. And then there's 8 million that have incomes between 50 and 75,000. And, you know, some people just choose not to have it. Exactly what to do about that. I mean, I really dislike paying that health insurance premium, but at the same time, I don't want to lose everything that I've built up over the last, 30 years with my family. Personally, myself, something I think that we really need to hit home on is what we carry at my house. And we have there's all 11 of us are insured. It's $275 per month. And what we are allowed to do is put $500 into a health savings account. And what we can do is, it doesn't matter if it's aspirins, eyewear, braces, having a baby, breaking a leg, we can use that money for that. And it's first dollar coverage basically for us. And what happens is, if I don't use that, unlike Social Security, that probably won't be there for me when I get old enough to receive it. That's my money, I own it, I'm accountable to it, and it can't be taken away. So those are just a few of the ideas that I have on helping this out. But I think what we really need to do is focus in on, I believe that we have the best health folks in the entire country. Our system needs to be tweaked a little bit, not totally torn down and broken down and then the government come in and take over. I don't really believe that this bill right here is about health care reform. I believe that this is about control. That's what this thing's about. And the thing that we got to remember also is that if they can get a little piece of that across that bridge, the rest of it will shortly follow. So that's really important to and it doesn't matter. This is not a Republican issue. It's not a Democratic issue. It's not an independent issue. This is an American citizen issue is what this is. So, thank you. Yes. Yeah, basically what it is, but it isn't. I know for sure that no matter what happens, it's a $10,000 annual deductible. But I also know that I'm putting, $500 a month in there, and I have that first dollar coverage. But the peace of mind comes knowing that if I do have something major happen, a heart attack, cancer, what have you, I'm not going to lose everything I own. Yes, sir.
I don't know if you got that far in reading the bill, but is it true that that the bill would make catastrophic care policies illegal?
I'll tell you with this bill, and I'm not going to be able to really, the problem with this bill is not what so much, there's a lot of things in here that's bad, but the problem with that bill is what they didn't put in it. Because what's going to happen, once they get that sliver across, then they're going to say, well, we meant this, we meant this. It's how the government does it. I mean, look at Social Security, for example. When it first got fired up, I think in '35, it was a voluntary program. You didn't have to contribute. That was going to be your money. So I haven't got to that part. And sometimes when I was rolling through it, it's not the most adventurous book. So you're kind of reading through it and trying. And one of the things is, I know for a fact that there's been Harvard grads that have read through that and they can't understand it. They cannot understand it. This was not written by simple people like us here in the room. I mean, I've read contracts for a long time, and I mean, there's a lot of stuff in there. I've got to call my attorney and say, hey, can you tell me what this means? And even he doesn't know sometimes on it. So hopefully that's not the case. So I have it. I'm going to read this thing 3 times, and then I'm sure they're going to have a couple more different ones coming through. So, and I got to try to study on other things also. So.